Okay, I can do that. So we'll go ahead and get started. Good afternoon and happy Mother's Day to all of those who are called mother by someone that loves them, and all of those who should be. So happy Mother's Day to all, and welcome to this afternoon's Black Health Trust. We are so happy that you're able to be with us this afternoon. And with no further ado, I would like to turn it over to our founder and leader, Dr. Randall Maxey.
Good afternoon, and thank you, Dr. Ivan Walks, my physician, my psychiatrist, and most of all, my friend. I thank all of you for joining us on this day. We have interesting topics to discuss, but we're going to be sure to abbreviate our time so as we can pay attention to our mothers and wives and even new mothers. But we have some very important topics to discuss. So I'm going to ask Simon to put up our first slide, and I'm going to invite some of our members of our advisory to comment as we go forward. So the first slide, Simon, or actually the one after that one. We'll continue with our topic of gloves off. No more Mr. Nice Guy. And I want to start with the mission statement of the Black Health Trust. The Black Health Trust provides a global source of credible healthcare information. Black Health Trust connects the expertise of medical, technological, and social health professionals to engage, educate, and empower the community. Next slide. Our vision statement, the Black Health Trust promotes the incessant engagement of global Black populations in the pursuit of the pinnacle of wellness. This valued resource for the community brings a collaboration of world-class physicians, scientists, and other professionals to address the health of communities of color. Next slide. Many of us belong to the organization that represents Black physicians in the United States and over the world, called the National Medical Association. The NMA promotes the collective interests of physicians and patients of African descent. We carry out this mission by serving as the collective voice of physicians of African descent and the leading force for parity in medicine, elimination of health disparities, and promotion of optimal health. Next slide. Due to recent events where there was a leak of a document from the Supreme Court of the United States, we know that the Supreme Court is poised to overturn Roe versus Wade and allow states to outlaw abortions. According to the written draft of the justice's opinion that leaked to the media last thing, this is confirmed by the Chief Justice. So in response to that, Dr. Rachel Villanueva, who is the president of the National Medical Association, issued the following statement. Dr. Waltz, could you help me read that?
I will. There is the slide may be a little bit hard for some folks to see because it looks like the title jumped down a little bit, but let me read through it. This is a statement, National Medical Association statement on the Supreme Court of the United States abortion, and it looks like the abortion law leak. And the statement is as follows. As African-American physicians, we are devastated by the impact the overturn of Roe v. Wade will have on our communities, our patients, and our profession. The decision to seek abortion care is a highly personal medical decision, a decision that should stay between patient and doctor, not the federal government. Restricting reproductive rights directly interferes with the ability of physicians to provide the best possible care for our patients. The results will be catastrophic for women everywhere, especially Black and brown women, and set a chilling precedent for the medical field. Close quotes.
So we can turn those off for a minute, Simon, if you would. So Dr. Waltz, I am a student of medicine, and I recall years ago when I was a senior medical student that one of my graduation requirements is that I had to perform what's known as a hysterectomy, which in layman's terms is a late stage abortion. And it turned my stomach. It bothers me to this day, and I will never engage in that activity on a personal basis myself. But having said that, as a physician, I have ingrained in me that a person's body and their life is sacrosanct to those individuals. And it is that person's choice, not the doctor's choice, even though I'm privileged to counsel and interact. But bottom line, we have to ask for their consent to do anything to them. So I'm not personally saying that I endorse abortion, but I do endorse that a patient, any patient, must be in charge of their life and their body. What do you think?
Well, Dr. Maxey, I think that we tend, when I say we, the public, we tend to talk about abortion as if it's a single thing and all abortions are the same. And what you mentioned just now was the challenge you experienced and were forced to experience in performing a late stage abortion. I think we have to really parse out what folks are talking about. First of all, let me start with all the people that I hear railing against Roe v. Wade and talking about rights of the unborn and all of that. I don't see them lined up at all the foster care places where I've worked, looking at children that don't have a home. I don't see them lined up demanding that we have better services for all of these children that they say will be much better off. So I think that to really disconnect those two arguments and by policy decisions, not care about what happens to these children, but say how important their lives are. I don't know what to say about that other than I think it's ridiculous. I think the two would have to be connected. And if you want every pregnancy to result in a live birth, then you have to be willing to talk about your commitment to all of those live births. Having said that and put that to the side, I think there's a big difference between someone who has an abortion resulting from some act of someone demonstrating their power, which is what rape is, which is what sexual assault is. It has nothing to do with sex. It has to do with someone proving I'm more powerful than you are. And I think that by now taking away a woman's right to exercise her power in what happens to her body. I think it's a compounding of this horrible, potentially horrible event that may have happened to someone when you try to act like all abortions are the same. They're not. Having said that, I go to church and we think that that life is important, and we think that having an abortion should not be something people do willy-nilly, and you shouldn't run out and get one, and all of those things. I think it's important for us to consider, which makes the question of abortion so much more complicated. And taking away someone's right to control their body in that way is another act of power against a woman's body. I'm going to tell you what you can do with your body. I'm going to tell you what you can't do. I think I agree completely with Dr. Villanueva that this can have horrible outcomes and will have horrible outcomes. And then the last point I'll make about this is, when these laws are passed, we've seen this in Texas and other places, basically it shuts down the abortion clinics in those areas. Not understanding that that's the place a lot of women go for care beyond just getting an abortion. Many of these places are places that folks go for different kinds of exams, different kinds of diagnostics. So I have another 3 hours I can talk about this. I'm just so upset that folks think that abortion is one thing and all of them should be treated the same, and that we're going to let these people who obviously don't care about children decide that everyone who gets pregnant needs to have a child. I just think it's awful.
Yeah, let me go a little bit further. Simon, if you go to the following slide after the last one you saw. So there are groups of people that call themselves, at least I'll call them anti-choice. And my concern that these people, instead of properly condemning government actions that harm living Black women in the Black community, such as dealing with poverty, police brutality, mass incarceration, etc., these people focus on Black women for practicing their own reproductive rights. This is what Dr. Walk was speaking about. And there are common stereotypes that they use. And I got this from a person I'm going to have on the Black Health Trust in the future. Her name is Dr. Randall, who is in Ohio at the University of Dayton, I believe. And Dr. Randall said that there are two stereotypes, the one of Jezebel and the other one of a Black mammy. And they're used as tools to justify the continued focusing on the reproductive capabilities of Black women. The Jezebel stereotype paints some Black women, particularly Black girls and young women, as promiscuous seductresses with insatiable sexual appetite. The stereotype helps normalize by some and explain away the rape of enslaved Black women and their masters or other men. So therefore they don't have the same rights. In 1858, in Applewood Court in Mississippi overturned the death sentence for a Black male slave convicted of raping an enslaved Black girl who was around 9 years old. The legal basis for the decision was that the law did not recognize rape between slaves. The young age of the victim and the stereotype mood led them to say that these girls induced their own rape. Now, I bring this up only to introduce the thing that abortion, even though it has its own rights and wrongs, I believe expresses what is going on these so-called strict constitutionalists that anything that was not mentioned directly in the original Constitution can be moved, including your voting rights, your civil rights, your human rights, because they did not anticipate that we would be other than 3/5 of a human back in those days when these things were decided. So I am concerned that we have to be very careful about where we go. Next slide. You can turn it off. Let's comment on this. And I'm going to bounce this off of Dr. Walker. I'm going to ask Dr. Steiner, and I'm going to ask Dr. Gary Dennis to comment. And I want Gary Dennis to comment after Dr. Walker talks. And I want to talk about when there is life, when the brain is developed, and those sorts of things. Dr. Walks, on the statements that I just made about the stereotypes where there was no reason for them to justify a law against another slave raping a little girl. That sounds pretty bad to me. But it sounds like an opening shot to saying, well, you didn't have rights when we founded this country. Why do you have rights now?
So, Dr. Maxey, you always look to me to be the one who is going to be a little bit more calm and a little bit more reasonable. I don't have anything calm and reasonable to say about that. I think that it's awful. I think that when these kinds of statements come up, they speak to the generalizations and, as you said, stereotypes about people that look like us. And I don't know how many times we have to demonstrate that we are a diverse group. There are all kinds of people that are from African descent. And so anytime somebody says, well, we're going to group you as a Black mammy or as a Jezebel or as a rapist slave or whatever it is they want to group us by, it's just wrong. And I think we have to continue to call it out, as you are doing today, that those statements are wrong. We understand how the
somebody needs to mute.
Dr. Dennis had some noise and he did go back on mute, so we'll have to unmute him again. So I think just to say in short, Dr. Maxey, we have to pay attention when folks are talking about us and thinking about us that way, not just so we can get mad and say it's ridiculous, but so we can be careful about what policies may come after that and how those policies may impact us as individuals and impact us as a community.
Well, thank you so much. One of the questions that I have concern about, which is more in the realm of there's a word in law that says sui juris, when you are able to make legal decisions, and we've decided that you are able to make legal decisions. I think it was age 21 the last time I heard. But Dr. Dennis, being a world-renowned neurosurgeon, what comments might you have on when a new baby or fetus is viable and potentially aware of life? And what term would you use for that, Dr. Dennis, if you're available?
We need to unmute Dr. Dennis again, if we can.
Dr. Dennis is former chair of neurosurgery at Howard University. And I like to comment on the fact that he was chair at age 32. And so that's pretty young for a department chair of any department, especially neurosurgery. Dr. Dennis?
So Dr. Dennis is still on mute, Dr. Maxey.
Okay.
There he goes. He's now available. Dr. Dennis, good afternoon, sir.
Good afternoon. Can you hear me?
Yes,
sir, we can hear you.
Good. All right. Yeah, I got the essence of your question. What do you think about I guess more like the age of viability, and what are the things that children who have congenital malformations may be subject to, and all that is taken into consideration at the time children are born. But sometimes they're born and they have anencephaly, which is basically is a child has no supratentorial brain activity.
So they're born with no brain, right?
Well, just the outskirts of the brain, no true functioning structures above the brainstem, and those children have a very poor quality of life. Usually, in situations where there isn't external ventilation for them, they won't have any significant period of life. They may be pronounced in utero.
Mm. And I understand that some of these children have to be kept in homes. They require around-the-clock care. It's unclear whether they have any intellect or self-awareness at all. And for many people that don't have that kind of family wealth to support that, that could be devastating as well. Is that correct?
That is correct.
So let me jump in here, Dr. Dennis. Thank you for bringing this up. My one of my older sisters had a child that was born with anencephaly and lived 30 days, only because she was in the Army and born into a military hospital, and they had tremendous resources, round-the-clock ventilator, and what have you. But the bill for those 30 days for my niece Vanetta was just unbelievable. It was unbelievable that a hospital bill for 30 days could be more than many people would make in their lifetimes. It was just awful. Had that not been a military situation and had not the Army picked up the entire tab for it. So the point that you're making is one that we looked at as a family, and we're just horrified at what some people would be forced to endure if there was no ability to, one, find out that this is the kind of birth that's coming, and two, be able to avoid what is just really a horrible experience for the family to go through something like that.
You know, Dr. Walks and Dr. Dennis and Dr. Steiner and others, often I'm faced as a physician who treats a lot of patients of the Medicare age, that you have somebody in their 98, 99 years old, they've had a devastating stroke, they have lost consciousness, they're in heart failure, kidney failure, respiratory failure, and they're on a respirator, which is extremely uncomfortable unless you're paralyzed or knocked out. And there's no chance of recovery. And I became aware, actually through Dr. Neighbors Stevens, of a recent law passed in California that physicians have the ability to decide when to end care of a patient that is so unable to live a viable life. They can actually turn the respirator off. And in the light of this pro-life or anti-choice, how would that sit legally if, as a physician, your judgment says you're going to stop that person from suffering and turn off that respirator? So this can go all sorts of ways. And I'm also concerned that there can be extreme criminalization of a woman who is trying to take care of her own life and own body and has to make a decision for her health when she happens to have an early term pregnancy, which is another issue that you're not going to stop abortions, whether they're in the hospital or the back alley. There are going to be abortions. And I'm concerned about a lot of people having legal issues behind this. But let me call a moment on Dr. Steiner, who's up in, is it Vermont?
Yeah, New Hampshire. Good afternoon,
Hampshire.
Dr. Maxey and everybody else.
Good
And
afternoon.
happy Mother's Day to everybody. Well, I want to echo exactly what you've said, Dr. Maxey and Dr. Walks, and how Dr. Villanueva came out with that statement that's kind of spot on. But if you step back and you look at this a bit differently, you see that, and it is a Republican attack on the most vulnerable population, and that is Black poor women. And it's a bunch of stodgy old men casting their views on women. And women have as close to zero say on this as I've ever seen on any issue. And many of these, I wish Barbara was on right now, Dr. Naprith, as we call her, because so many of these abortions are done on young teens that have been raped and out of wedlock people that find themselves in a position any of us could be in, or they're financially unable, or as you brought up, well, there are medical issues to be concerned about quite frequently, from drug abuse to you name it. So in my view, I've stepped back and I've looked and I said, I think Dr. Walks brought it up. The Republicans aren't willing to face the consequences of this. In fact, they're the ones who always cut back on all the programs, including medical programs, to support children. So it's shocking to me. The answer I get is, oh, there are foster homes and that sort of thing. Well, we all know there's not enough. And so I think today is Mother's Day. We got to tip our hats to all the women out there. We got to stand up for the women. They have, the least voice. They're the most vulnerable of all of us, and they're being attacked by this law directly. So I hope I brought another angle to this, but this is a great discussion. Thank you.
And those foster homes, even though many of them are quite good, there's so many horror stories of people who've been in multiple foster homes with bad results. And those happen to be our children. So we have to look at all ends of the—
A little video on me.
Yeah.
Yep.
Is Dr. Johnson on, Rhonda? Do you see her, Dr. Walks?
I do not see Dr. Johnson.
Are there any
But
other?
let me follow up on something that Dr. Steiner said, and then you also said, Dr. Maxey. For some reason, people who have never really worked in the foster care system think that it's somehow ideal. And there are great foster parents and great stories of people who come through the foster care system and do well. I would challenge anyone who says that's an ideal way to raise a child. And that's a great decision to just put kids into the foster care system. I would challenge anyone, because I spent time working in that system, actually worked with a foster care, a state foster care agency to design a system of care for kids in foster care. It's not ideal. I think the people who run those systems do heroic work. I think they work very hard and they do their best, but that's not an ideal system. So let's just not let anyone say that, oh, we have things in place. We there's a right to life and every child has a— no. I think, but I think the main focus for this is that because these laws in these states that they're beginning to pass are so different, it's, to go back to Dr. Villanueva's statement from the National Medical Association, it is absolutely important for us to recognize that this is not just do you believe in abortion issue. This is a women's health issue. And so when you pass a law that doesn't allow women to seek help in a place. It's an access to healthcare issue. It really is. So I appreciate Dr. Steiner's point about the stodgy old men who continue to think they need to be in charge of everything. Goodness knows we can't let the women decide for themselves. So the stodgy old men need to, it's so typical of what we do in this country, and it's so bad. We just need to stop doing it.
The other thing I'd like to bring up that's tangential to this is that I hear some of these stodgy old men saying, we don't want Sharia law. We don't want Muslims telling little girls and women they can't be educated and they can't drive. But we are willing, it seems in this country, to accept evangelical law, that many of these white Christians who want limited government except for the items that are their hot buttons. Then they want the government to come in with a big foot. I heard a survey given on TV today saying that if the United States were divided into its two camps, the so-called conservative camp and the so-called liberal camp, that the conservative camp would be more like Nigeria and Uruguay in their temperament, and that the liberal camp would be more like Sweden and Northern Europe. But we have two societies, it seems, and we're now so divided, but we're trying to say that religious beliefs should run our country, which is supposedly created as a secular country, so that people could practice any religion that they so chose. But it looks like things are breaking down in a more religious way, and which turns out to be a more racist way and a more classist way, that we have to be very careful, since we happen to be at current a voting minority, both because of design and also because of apathy on our point. So Donald Trump, when he was president, said something that impressed me very much. He said, elections have consequences. And we can do all this boo-hooing, but we decide that elections at the city level, county level, state level, as well as the national level, don't affect us, then we pretty much deserve what we get, in my opinion. I will say that. Any other comments, Dr. Walks, on this topic? I want to move on if not.
Well, I do have a comment on what you just said, Dr. Maxey. I think that we spend time looking at the challenge of voting and the redrawing of districts and voting rights attacks, and the fact that there's a lack of a federal right to vote. All of those things we spend a lot of time looking at. And at the same time, we watch other groups use whatever means they can to get the vote out for their issues and to show up and vote. One of the things you mentioned, apathy. One of the things we talk about on the Black Health Trust a lot is the motivation that we need to protect our own health. We talk about that, and we've also talked about the motivation to get out the vote, right? So I try to recognize what the challenges are, and then I just ignore them, because we have to move and do the things that we can and not spend as much time. My one little quick story I tell all the time, when I told my mom how hard it was for Black folks to get into medical school, I would say, Mom, in a class of 100, they may only let one of us in. And she said, no, really? I said, Mom, only one of us might get in out of a class of over 100 students. And she looked at me, she said, well, how many seats do you need? That was what, and yet I still love her on Mother's Day because it was her fault. I wound up in a class where I was the only Black man in my class of over 100 medical students, but I made it through. And I think it's important for us to recognize that we do have mothers like that who will talk to us about the opportunity. Oh, you mean they may let one of you in? That's the opportunity. So many times we focus on the fact that they will only let one of us in. So to your point, Dr. Maxey, yes, the playing field is tilted. It's almost like an 89-degree angle. They want us to slide off. But there is an opportunity for us to push through while we are holding somebody to pull along behind us, and we are working for change. So you're never going to see me just throw my hands up and say, oh, this is way too hard, it's way too unfair. Because my mother's still around. She might hit me in the back of the head if I did that.
There you go. And happy Mother's Day to your mother. She is a great lady.
You're still her favorite doctor, even though I'm one. I don't understand how you can be my mother's favorite doctor, Dr. Maxey. Tired of it.
Uh-oh. I'll go. She's right, though. Let's move to the next slide, Simon. So recently, there have been reported relapses with a medication called Paxlovid. As you recall, Paxlovid, we spoke about it last week, is the oral drug given within a 5-day window, I believe, after one has been tested positive with a rapid test and has symptoms.
Right.
And on the prescription of your physician, you can get this medication. But it's been reported that there are relapses that occur, but they're confident that they're reobserving relapses that happen after a 5-day course of treatment with Paxlovid and COVID-19. Others have said that even with the original COVID-19, that it's a biphasic response, and that many relapses happen even without Paxlovid. So there's some concern, however. Next slide. So the FDA, as per Dr. John Farley, who's the Director of Infectious Disease at the Center for Drug Evaluation and Research, said that there is no evidence of benefit for repeating a treatment course in people who relapse. Dr. Sachs from Brigham and Women's Hospital said he would limit retreatment or another course of that medication with a second course to the most vulnerable patients who have the highest risk of hospitalization. For patients that have mild relapses, he would not retreat them with Paxlovid because he acknowledges that without data, we don't know if we're doing good or harm. So it sounds what the party line is saying, if you have exposure, if your rapid test is positive, that you should continue to take the Paxlovid for 1 dose. But if your physician believes that you're immunocompromised or you're vulnerable for other reasons, then you should go ahead and take a second treatment. Is that clear? Dr. Walks, Dr. Steiner, Dr. Smith, is Dr. Jordan on today?
I do. Yes, I do see Dr. Jordan. I think what's clear from this, Dr. Maxey, and I'll start and let others jump in. What's clear from this statement is that there is no indication that folks should not use the Paxlovid. So if you do have your positive test and you do have symptoms, using Paxlovid for that 5-day course is still the recommendation. There's nothing in here that changes that recommendation.
Correct.
Dr. Maxey, that's right. Dr. Maxey?
Yes, go ahead.
This morning, there was a release by the CEO of Pfizer, who said, just like many antibiotics, if you get a rebound, you can take another string of the dose for 5 days. And of course, everybody attacked that, saying, of course, he wants to sell double the amount, right? But anecdotally, they say it's rare. And yet I've been involved in 6 cases of COVID in the last 4 days. And last week, the week before, my cousin, who we treated with what we call Pax now on the street, and we treated her with the Paxlovid, and she rebounded tremendously. And we gave her a second course. So I think this rebound is going to be reported more frequently than we see. And I think this is a moving target again with COVID. And I think that the treatment protocol is going to be changed in the months ahead. Just my 2 cents worth.
Thank you. Is Dr. Jordan on?
Yes.
Dr. Jordan, you're going to comment?
Well, I agree with everything people have said. I think in addition, there are other viruses out there. The question comes whether people should only use Paxlovid if their home test or if their test is positive. I've had 2 cases where patients started it beforehand. The virus, the test wasn't positive, but they felt better afterwards. So we have a whole new thing. I mean, it's not going to hurt. One of the drugs is an old HIV drug that boosts other things. It's a booster. So I think it's much easier for you to have it on hand, take it if needed, rather than waiting and having to deal with being hospitalized. So, but as one of the other doctors said, I think there will be new recommendations coming out soon dealing with re-exposure, et cetera.
Okay, thank you so much. Simon, let's go to the next slide. So, in summary, patients who relapse and have symptoms and positive antigen tests, that's the rapid test, need to behave as if they're contagious and can transmit the virus to others.
Correct.
Okay, so this should be something, and WHO means WHO, not World Health Organizations. I didn't mean to capitalize that. Next slide.
Wait, Dr. Maxey, hold on just a minute. Just a minute. So patients who relapse and have symptoms and a positive antigen test, can I just replace that first part with everyone? Everyone needs to behave as if they are contagious and can transmit the virus to others. As Dr. Jordan just said, there's more than one virus, there's more than one thing that makes us sick. I was on an airplane yesterday, and the woman sitting in front of me and on the other side began coughing and blowing her nose and didn't have the mask on. She'd pull her tissue out, and I was sitting there with I cinched my mask up extra tight, and the woman sitting next to her, next to the window, just got up and crawled over and got out of there and went up to the front of the airplane. Next thing I know, she was sitting down up front. Didn't even come back to get her stuff. So wow. I just think we have to be considerate of other people. So I'd like to replace that whole thing with everyone needs to behave as if they are, because we know by now, and I'm sure Dr. Steiner, Dr. Jordan, Dr. everybody would agree with the fact that there are people who are asymptomatic that can transmit the virus. So let's just all act like if just because the hospitals aren't overflowing and we've opened up things and mask mandates have been lifted. Let's not act like the virus has gone. And we know that in many places, viral counts are going up, despite the fact that people aren't reporting as much because they're testing at home. So anyway, I just, yeah, Dr. Maxey, fix your slide. It's wrong. Everybody needs to act that way.
Okay, you're right.
Yeah, let me just say, at the SNMA conference 3 weeks ago, they honored us old folks, and we all took our mask off. And just as we did, this one lady just started coughing and sneezing. And we were all trying to be nice because they were honoring us. And 2 days later, we get a call saying she'd been hospitalized. And 2 days after that, another one was hospitalized. So just to dovetail on what he just said, we have had enough experience now to know if someone is really showing symptoms, protect yourself. And anyone who may not have been infected before, if they have symptoms, if they're showing it, then they are. So rather than saying patients, because patients imply they've been sick, anyone can relapse. And people don't know, but I think we have to be very careful. And because we are having these relaxes and things in quarantine, people are going to have more situations that we've not had in the past. I am again concerned that next fall, we may see an even higher bump. So we need to we can't get tired now. I mean, that old gospel song, I've been running for Jesus a long time, I'm not tired yet. We can't get tired after 2 years.
That's true.
It is not over yet.
Dr. Jordan, the song is "I Don't Feel No Ways Tired."
That's another one. That's a younger one. That was the Barrett sisters. I've been running for Jesus with the caravans.
Okay.
Okay. Let's go to the next slide, if you would, Simon. I thought I had something before that. There's a slide before that.
Well, there's a slide after that, Dr. Maxey, about the frontline doctors.
Okay, no, the one I wanted was the fact that the FDA is recommending now against the J&J vaccine.
That comes after.
Find the one about J&J. Okay. I don't see it yet. I'll just read it.
There it is.
Okay. So the FDA came out, they had paused the use of J&J April of last year in favor of the 2 mRNA vaccines. So now they're saying it should only be used in certain adults, but we shouldn't use it as a first choice. And there's been updated analysis of rare cases of thrombosis with thrombocytopenia. This is called TTS, which is typically occurring 1 to 2 weeks after the vaccination use of J&J. And they want that vaccine to be restricted to those people for whom the mRNA vaccines are not accessible, or they're not clinically appropriate, or who could not get vaccinated if it weren't for the J&J vaccine. So it is no longer a first-line drug. But if it's the only thing out there, they're saying take it. But if there's some other opportunity to get something else, they're saying take that. Now, the numbers, if you can put that up a little bit, Simon, the reporting rate of thrombocytopenia is 3.23 per million doses of vaccine administered. And the reporting rate of thrombocytopenic syndrome deaths is 0.48 per million doses of vaccine administered. So now that's still a very small number. So it's not saying that J&J is necessarily going to kill you, but the numbers are still not acceptable. And they're saying that the greatest risk is among women ages 30 to 49 years, which is about 8 cases per million doses. And they're also saying, importantly, that thrombocytopenic syndrome may have long-term consequences that still have not been totally come out. So that is to say, for all of those of you who thought just getting stuck once was good, that's not good. The mRNA vaccines are definitely better in terms of risk profile. Any comments? Dr. Walks, you did that task force that we had on vaccines. I'd like your comments on what we're saying here.
Randall,
Well,
Yes.
if you had a list of all the primary care doctors in Los Angeles, all the Black primary care doctors in Los Angeles, and you emailed them and asked them what vaccine did they have, do you think they would know whether they had an mRNA vaccine or not?
If they took it or if they have it available?
No, I mean, if they had it for their patients.
Most of them don't have it.
No, well,
Anything.
first of all, most of them don't have it. But if you were to call right now 10 primary care doctors and say, have you been vaccinating patients? Yes or no? And the answer is yes. Was it with an mRNA vaccine or was it with something else? I don't think most would know whether it was an mRNA or whether it was something else, or whether they know an mRNA and Johnson & Johnson are different. I mean, my point is, this is good information, but I don't think it's being shown at a way the average provider to patients is going to understand it.
Well, I hope you're wrong.
Well, let me just clarify. Dr. Jordan, what they're talking about, to just break it down to what we've all heard in the media, is they're talking about the one-shot vaccine, which is the J&J.
Right.
In terms of what's been available here, the one-shot vaccine is the J&J versus the two-shot vaccine, which are the mRNA vaccines, the Moderna
Right.
and the Pfizer. I would hope that most doctors would know when they're giving someone a shot, whether to tell them this is your one shot and it's all you need, or whether to tell them this is your first shot and you need to come back for the second shot. So I would hope that they may not understand or pay attention to mRNA versus non-mRNA, but the Johnson & Johnson one, as Dr. Maxey started off with, was the one-shot vaccine.
Okay, so the word from this is saying, get vaccinated, whatever you do. But if it's available to you, take the mRNA vaccine, the two-shot regimen, which is either Pfizer or Moderna. Those are the two preferred. If you can't get the two-shot regimen, which is Moderna or Pfizer, then get vaccinated with the J&J. But we're saying that the risk is potentially higher, but it still is not as risky as being unvaccinated, period. But this just gives you a little bit more sophistication. Let's go to the next slide. I think we're getting close to the end of our time.
Dr. Maxey, while we're fast forwarding to the next slide, you know, we talk a lot about the small chances of someone getting sick from the vaccine, and we've had folks come on and talk about, well, put in the chat concerns about what happens with the vaccine and all that. I read something today that should make all of us concerned, and I know you, Dr. Maxey, have talked a lot about the little blue pill that brings things back to life. I hadn't thought about the fact that we've learned over the last few years that COVID is a systemic illness that can impact all the different parts of our body. And we had a wonderful young woman who was willing to come on the Black Health Trust and talk about how devastating a multi-system illness COVID-19 was for her personally and the horrible consequences. Let me get some men's attention on Mother's Day by saying that I read that they've documented that impotence can be a problem consequence of COVID-19 for an obvious reason. COVID-19 impacts our little blood vessels. You need little blood vessels working to have good erectile function. So those little maybe risks of getting the vaccine, maybe we should reconsider that those are worth it if you're talking about long-term blood vessel damage that can result in impotence. That got my attention, Dr. Maxey.
I just got a call from Walgreens. There's been a run at Walgreens. Everybody is going there to get their vaccine based upon what you just said.
Look, I'm just saying that we spend a lot of time talking about, well, there's a 1 in a million or 2 in a million. I don't care if it's 1 in a billion. I think that a lot of men are concerned about anything that might impact long-term. I have a lot of patients who I prescribe antidepressants to, and one of the main reasons that they say I can't take this is because a potential side effect can be impotence while they're on the medicine. Take the medicine away, the impotence goes away. We know COVID can be long haul, and that's not something I think most men want to have happen for a long period of time, is that function goes away. I think it's important that we put it out there.
So Simon, let's give it a side and let me comment. How impotent are you if you're dead? So well, Simon, you can take the slides away.
And no, but that's nothing new. I mean, a lot of our uncles and grandparents died from hypertension because they wouldn't take the early medicine. I mean, some of the early medicines worked, but they caused massive impotence, and a lot of our Uncle Joes and Uncle Johns wouldn't take it because of that. So I think the issue he raises is very important. When a drug causes impotence, many men will not take it. And we need to know how to deal with that.
So in our final few minutes, and I don't want to spend more than 5 or 6 minutes before we close, I'd like to open the microphone on a few people and let them express love for their mother or the mother of their kids. And I'm going to start off with Simon. You want to say anything about your mother or to your mother?
I want to say happy Mother's Day to an amazing mother. She's done so much for me in my life. I wouldn't be the person that I am. I wouldn't be where I am as a man. And I wouldn't be the father that I am without the mother that I have. So I give her all the respect that she is due and all the love that she deserves every single day. I let her know.
Okay. Mr. Dickerson. Can you unmute Mr. Dickerson? I'm going around the thing, so get ready to unmute yourself. Ms. Taylor, Ms. Julianne Taylor, I want to say a quick mother's statement.
Yes, and as a matter of fact, right now my mother is on her way over to pick me up to get together with family this afternoon for a cookout.
Say happy Mother's Day to her.
Yes, I will. And she's 89 years old and in her second career as an ordained minister within the Presbyterian Church. As I told you, my paternal grandfather was of 15th Street Presbyterian Church in Washington, D.C.
Bless her heart.
That was mentioned in that article.
Yeah. Let's keep our statements short.
But anyhow, so yes.
Okay.
So yes, she's in her second career doing that after being a
Thank you.
public school teacher many years.
Thank you. Mr. Carl Brooks. Mr. Carl?
I've just talked to my 97-year-old mother up in Philadelphia. I sent her flowers and I told her that for my 50th anniversary with me and my beautiful wife, that we're going to have a party and she's got to be able to dance to gain admittance to the party. So between now and then, we're going to be working on her dance moves. Drina and I, my daughter, Dr. Karima Kendall, took us out to a place in DC. It's the gathering place where really high-end brothers and sisters do a lot of socializing in the city of DC. We went there for a wonderful, wonderful brunch, and my beautiful wife and beautiful daughter celebrated. But I am in love with the beautiful women in my life that have impacted me in such a positive way.
And thank you. Has anybody else got their hand raised for a quick statement about Mother's Day? Mr. Dorsey, Ms. Jackson, Ms. Mentor? Just raise your hand so Simon can see you in the chat.
Mr. Dorsey's unmuted.
Mr. Dorsey?
Happy Mother's Day to all the great mothers out there. Everyone knows that our nation, the strength is in the Black woman holding the family together. Have a blessed day.
Amen.
Thank you, very good. Anybody else have a brief Mother's Day statement? Go ahead.
I see Dr. Steiner had asked to be unmuted again. I'm not sure if we got that earlier or not.
Dr. Steiner?
Okay, thanks, Ivan. Yeah, I got it. That was from earlier, but my mother has passed, but I think mothers give love and guidance, and I hope that I've lived up to that love and to be able to pass on the wisdom and the love to others.
Well said.
That's my
Well
message.
said.
Anybody else want to make a statement?
Oh. Yes, Dr. Maxey, was that Mr. Brooks who said he resides in Philadelphia also?
Yes.
Is he? Oh, he's muted.
Anybody else want to make a statement?
Randall,
Yes.
yeah, my godmother lives in Cambridge. She's 104,
All right.
and her
That's
memory
all
is
right.
better than mine. So I'm getting ready to call her as soon as I hang up, and then I'm going out to Inglewood Cemetery to visit my mother's crypt.
Very good. Very good. Any others, Dr. Walks?
I don't see anyone else, Dr. Maxey. I think we can begin to wind down.
Okay, well, I want to say happy Mother's Day to your mother, Dr. Walks, who is a wonderful lady that I had the opportunity to meet some years ago, and she's always stuck in my mind of how great a lady she is, and I'd like to give honor and thanks to my own mother who raised me. She's since passed, but she's with me every day of my life. I got a picture over my desk, and she still keeps me straight. And then, of course, to my beautiful wife, who's in DC. Now she's run away with a 5-month-old baby. And maybe I'll get to see her in the next couple of weeks. My wife, Jim, happy Mother's Day. Well, thank you. If nobody else has a statement, we thank you for joining us on today.
So Dr. Maxey, this is why you and I have a problem. You wish my mother a happy Mother's Day, but you don't give me a chance to wish her happy Mother's Day. This is why she likes you better than me. Now I understand. It's all part of your devious plot. It's all part of your plan. So if I may, I would like to wish a happy Mother's Day to my mom and to my wife and daughters and everybody else. Oh, Dr. Maxey, I'm going to get you. You better stay out of DC. I'm gonna get you.
So, Mrs. Walks, protect me, please.
She will.
I'm your favorite stepson. Have a good day, everybody. Thank you.
Bye,
Thank you.
everyone. Happy
Have a
Mother's Day,
wonderful Mother's
everyone.
Day.
Happy Mother's Day.
Bye-bye.